And now let's go over the next section. It's on the results. So let's go over the results of the paper. And the first section of the results is discussing the patients. So the first part of the results went over the patients used in the paper/research. And let's take a look at this. So patients, 3 adult patients were presented with severe pneumonia and were admitted to a hospital in Wuhan on December 27, 2019. Patient 1 was a 49-year-old woman, patient 2 was a 61-year-old man, and patient 3 was a 32-year-old man. Clinical profiles were available for patients 1 and 2, and a clinical profile is a detailed summary of a patient's medical history. So that's what they were available for patients 1 and 2. Patient 1 reported having no underlying chronic medical conditions, but reported fever with temperature of 37 degrees to 38 degrees, and cough with chest discomfort on December 23rd, 2019. 4 days after the onset of illness, her cough and chest discomfort worsened, but the fever was reduced, and a diagnosis of pneumonia was based on computed tomographic or CT scan. Her occupation was retailer in the seafood wholesale market. And let's go over tomography is imaging by sections using a kind of penetrating wave. And a computed tomography CT scan uses X-rays to penetrate through the body and measure the loss of intensity through the body. And radiography in general is just a general imaging technique using X-rays, gamma rays, or similar radiation to view the internal form of an object. And here is figure 1 right here. Or actually, I got rid of that figure 1. That was just from Wikipedia there. So basic principle of tomography, superposition free tomographic cross-sections S1 and S2 compared with the not tomographic projection P. So if you have this, these free ones, basically you take a slice from here, and then you'll have an image that shows a slice in this exact region, and then there's another one over here. So that's a tomographic as S1 and S2. But then image P is just looking at it from this way. It's just a projection of all these onto here, which is not a tomographic one because you don't know. It basically doesn't show. It doesn't show detail in terms of the thickness through it because this is all just lumping everything together in a 2D image. Versus this one here, if you had a whole bunch of these, you can get a 3D image like this. And so on. But so you get a slice through that, and you'll see which items are seen in it and are seen on the same plane, and which are not. Very interesting stuff. And going further, here is a CT scanner. So you lie down in there and scan through this whole thing. Fascinating stuff there. Anyways, continuing further into the paper. So patient 2 initially reported fever and cough on December 20th, 2019. And respiratory distress developed 7 days after the onset of illness and worsened over the next 2 days. And then see chest radiographs figure 1, at which time mechanical ventilation was started. He had been a frequent visitor to the seafood wholesale market. And patients 1 and 3 recovered and were discharged from the hospital on January 16, 2020. And patient 2 died on January 9th, 2020. And no biopsy specimens were obtained. I believe this is for all of the patients. So respiratory distress is the condition of having trouble breathing, and mechanical ventilation, right here. So this patient 2 had mechanical ventilation. Is the use of a ventilator to provide artificial ventilation, which is the moving of air into and out of the lungs. And discharge right here refers to releasing a patient from a healthcare facility after receiving medical treatment. And a biopsy is the removing of a sample of tissue from a body for examination to determine the presence or extent of a disease. And here is a ventilator right here. And then you just connect it to the person's body and have it breathe for them mechanically. It's very, very interesting. Continuing further in the paper, and we have these chest radiographs right here. That's figure 1. And again, this is for patient 2. And then let's have a look at these radiographs. And the information here. So shown are chest radiographs from patient 2 on days 8 and 11, after the onset of illness, and the trachea was intubated, or basically a tube shoved down the throat, and mechanical ventilation instituted in the period between the acquisition of the 2 images. So, for example, here's the first one after 8 days after the illness, And then they got mechanical ventilation, and this is after 11 days of the mechanical breathing. And yeah, so you have a bunch of very interesting images there. And then it states here that bilateral fluffy opacities were present in both images, but are increased in density, profusion, and confluence in the second image. And these changes are most marked in the lower lung field, changes consistent with accumulation of pleural, let's try that again, a pleural liquid are also visible in the second image. So let's, basically what it's saying is that it's basically have some fuzzy areas right here and becomes more fuzzy here in the lower part on here. So you can see through it here. Notice after 11 days now it's becoming even more opaque. So the trachea or windpipe is a tube that connects the larynx to the lungs, and intubation is the medical procedure involving the insertion of a tube into the body. And then these bilateral fluffy opacities refer to radiological findings on chest images involving cloudy or hazy areas on both sides of the lungs, indicating various medical conditions. And opacity is the measure of impenetrability of electromagnetic radiation or other kinds of radiation. And over here has increased profusion on the bottom image. Profusion refers to the extent or degree of something, so it's increased more of these bilateral fluffy opacities with those hazy, cloudy areas. And confluence refers to the merging of multiple structure, in this case, fluffy opacity. So you have multiple of these all merging into one region there, or just making it, all merging together into this image there. You see them all together. And the next one is right here, the pleurae, or plural for this pleural. Yeah, I believe that's plural for it. But anyways, the pleurae are two opposing layers overlying the lungs and inside the chest wall. And pleural liquid is the fluid inside the space between the pleurae and acts as a lubricant. So if you have the lungs here, and then you have the chest wall around it, and now on this layer there, you're going to have this double layer there. So there's a pleural cavities in between. There's a double layer there, and there's fluid inside this that acts as a lubricant. There's an intercostal muscle. That's these parts right there on the chest wall. This is very, very interesting. Yeah, so this shows that there's accumulation of that pleural liquid inside, in between the lungs and the chest wall, which is supposedly that is what's occurring and making it more opaque from the CT scan. So very, very interesting. All right, continuing further. Yeah, now we're going to take a look at the summary of patients' results. So here's a quick summary of the patient's results. 3 adult patients with severe pneumonia were admitted in a Wuhan hospital on December 27th, 2019. And patient 1 was a 49-year-old woman. Medical history was available and had no underlying chronic medical conditions. And then had a fever. She had a fever and cough with chest discomfort on December 23rd, 2019. 4 days after onset of illness, her cough and chest discomfort worsened, but fever was reduced. And she was diagnosed with pneumonia based on a CT scan. So she worked as a retailer in a seafood market and recovered and left the hospital on January 16, 2020. Patient 2 was a 61-year-old man, had medical history was available as well, and had a fever and cough on December 20th, 2019. Had trouble breathing 7 days 7 days after illness started. The illness worsened over the next 2 days, which time was placed on, or I'll just fix that up, at which time a ventilator was used to artificially push air into and out of his lungs. And he died on January 9th, 2020. And patient 3 was a 32-year-old man and recovered and left the hospital on January 16th, 2020. It doesn't show much info on this. And no biopsy or tissue samples were obtained from any of the patients. So here's a note here. So 3 patients, a small sample size, again, just 3. No samples taken, and still no, quote, virus proved anywhere. So it's very interesting.